Like to present lecture on the title of Retention, Support and Stability of Complete Dentures. As a definition for the retention, it is the quality of denture that resists movements away from the tissue. Factors affect the retention of complete denture. First, the anatomical factor. Second, physical factor. 3, mechanical factor. 4, muscular factor. And surgical factor. The first factor, the anatomical factor. First, we have a denture bearing area. The greater the denture bearing area, the greater the retention will be seen. For the vault form, U-shaped, we have either U-shaped or V-shaped or flash-shaped palate. For the U-shaped vault, we have good retention and stability, while the V-shapes have a retention but no stability, and any pressure on it could break the seal. Flat shape, no enough depth, so no retentions and stability. For the arch form, we have 3 types of arch form, either square, ovoid or tapered, but the best one is the square. For the arch relationship, most of the edentulous patients have class 3 because of the pattern of bone resorptions of residual ridge, as we discussed previously in the lecture of residual ridge resorption, so that the limited in movements only opening and closing. The 5 point is the inter-arch distance. The smaller the inter-arch distance space, the more the retention. For the tongue, if too big tongue, this could interfere with the denture, so dislodging of the lower and upper. For the mucosa, we need it firm, compressible and even thickness, not to be sticky, thick and flabby. And we have 2 types of mucosa, either thick or thin, and the thin mucosa most of the time cause pain by pressures from denture. If the tissue are displaced while making the impression, the same configurations will be recorded to the denture, and the displaced tissue rebound displaces the denture, so loss of retentions occur. A physical factor. Physical factor include adhesion, cohesion, interfacial surface tension, viscosity, gravity, capillarity, and atmospheric pressure. For the physical attractions of alike molecule, for each it is either ionic force, salivary glycoprotein lead to acrylic resin and the denture base and the surface epithelium of the mucosa of the mucous membrane. So we have an attractions between alike molecule of the salivary materials, salivary protein, glycoprotein, with the acrylic resin from one side, and this salivary protein will have an adhesion with the surface epithelium of the oral mucosa from the other side. Adhesion. The effectiveness of adhesion depends on the close adaptation of the denture base. As there is more close adaptation, so the retention will be more, and the type of saliva. If the saliva is thick, croppy, so this will lead to reduced retention, and while thin saliva cause more retention. The area covered by denture, the maximum area coverage by the prosthesis lead to more retention. Adhesion. Watery saliva will better adhesion. Thick, croppy saliva, it will build up a pressure and push the denture out of position. Area covered by the denture. The size of maxillary denture bearing area about 24 square centimeters, and that of the mandible is about 14 square centimeters. Here is the picture which represents the cohesion, which is the interactions between like molecule, while the adhesion is the interactions between alike. For the viscosity, it is the resistance to flow of fluid result from intermolecular forces acting within the fluid. So the fluid having a high viscosity resists the flow more effectively than those of low viscosity. The additional saliva will cause loss of retention of the denture because of the resultant increase in the distances between the denture and the mucosa. Wettability. For adhesion to be accomplished between a solid and a fluid, wetting of the solid by fluid must take place, and the degree to which this occurs is depend on the relative surface tension. Wettability characteristic may be described in terms of contact angle. So high contact angle indicate wetting, and this is the diagram show this angle, and the left picture show the bad wetting, on the right pictures show good wetting. And good wetting, it's occur when the angle of contact between the adhesive and substrate is inferior to 90 degrees. And complete wetting occur when the molecular attractions between the liquid and solid molecule is greater than that between similar liquid molecule. Whether or not giving a liquid will wet a solid depends on the surface tensions of both substances. Cohesion. As a definitions for the cohesion, which is the physical attractions of like molecules for each other within the layer of interposed saliva and maintain its integrity, and high mucinous saliva more cohesive and less retention. Factor affect cohesion: area covered by denture, thickness of salivary film, and adaptations of denture base to mucosa. And this is the picture show the chain of intermolecular forces between the denture and the mucosa contributing to retention. Interfacial surface tension, as a definition, as it is the tension or resistance to separation possessed by film of liquid between two well adapted surfaces. And these forces are found within the thin film of saliva separating the denture base from the tissue. And this film of saliva tend to resist the displacing forces which tend to separate the denture from the tissue, and it play a major role in the retention of maxillary denture. To obtain maximum interfacial surface tension, salivary should thin, perfect adaptation should be present between the tissue and the denture, and the denture base should cover a large area, and their denture should have a good adhesive and cohesive forces. Capillary attractions. Elevation or depressions of surfaces of liquid that is in contact with the solids means capillary attractions. Factor that aid to improve capillary attractions is close adaptation of denture base to soft tissue, greater the distance, less the capillary force, greater the size of the denture bearing area, greater the retention, and saliva that is thick or ropey decreases atmospheric pressure. When displacing forces act on the denture, partial vacuum is produced between the denture and the soft tissue, which aid in retention. And the factor affecting atmospheric pressure, closeness of adaptation, mainly depends on the impression technique and impression material and proper border mold. Peripheral seal. Peripheral seal is defined as the area of contact between the mucous membrane and the peripheral polished surfaces of the denture base. To have good peripheral seal, the relationship between the width of the buccal channel and the resistance to flow of saliva, left wide channel, rapid flow, poor retentions, right narrow channel, slow flow, good retention. And this is in case of the peripheral seal, drop in pressure of saliva film as a result of displacing force causing impactions of the buccal mucosa and greater increased retention. This is in case of